Hello viewers, I am Dr. Suma, consultant, 49 Fertility Center, Vijayawada. There are so many treatment options available for infertile couples, and one among them is IVF, in vitro fertilization, wherein we collect the eggs from the wife, we fertilize them artificially in the lab with the husband's sperm, embryos are produced and these embryos are transferred back into the uterus. Now, is it true that only older women have been offered an IVF, or is IVF suitable for all? So, the decision of whether we need to do an IVF for a particular couple depends on many things. Age is definitely a very important determining factor, and as the age increases, the fertility solutions that we have decrease and the success rate of these solutions also decrease. So, normally we have two options for the patient, that is an IUI or an IVF, and IUI is a process wherein we artificially inseminate the female at the time of ovulation. This only improves her chances of pregnancy. So, IUI success rates drastically decrease with age, and usually on an average after 40 years of age of the female, we usually do not suggest an IUI at all, we prefer going for an IVF. Now, does this mean that those who are younger than 40 years are not offered an IVF? Definitely not. We come across so many couples who are extremely young, but they have so many other problems wherein they have to go through an IVF. For example, if the patient has both the tubes being blocked, so if they have a bilateral tubal block, there is no way that the egg and sperm will meet, there is no way that the fertilization can happen naturally, so we have to offer them an IVF. Supposing she has a grade 3, grade 4 endometriosis, the chances of a natural pregnancy or a pregnancy through an IUI is extremely difficult, and even a grade 3, grade 4 endometriosis can happen at an earlier age itself, where we may have to suggest an IVF. Supposing the male partner has severe count problems or motility problems, that is the count is extremely low or the motility morphology is extremely low, then there is no other prospect but to go ahead for an ICSI. So, it is not just the age which determines what kind of treatment that the patient is offered, it is a combination of the age, the history of the patient, the examination findings that we have, the investigations that we do, and suitable couples only are offered an IVF. On an average, 80% of the couples in one single year will conceive naturally without any treatment, and this increases to 90% in 2 years. For couples who are married for less than 5 years, IUI really works well, and for couples who are less than 40 years, IUI still has a chance. So, but for couples who are married where the female partner is more than 40 years, I think IVF is a better option. Apart from these, where IVF is definitely indicated is when the patient has a bilateral tubal block, when there is a severe male factor infertility, when there is an endometriosis stage 3 or stage 4, in patients with PCOS where all the other options have failed, or when the patient wants to go for a donor oocyte, or when the patient has extremely chances of success with IUI, that is multiple cycles of IUI have failed. In these patients definitely will offer an IVF irrespective of the age. So, definitely age is an important determining factor of which treatment we need to go ahead with, but does not mean that all older women have to be offered IVF. There are so many other determining factors which tell us whether the patient actually needs an IVF. Lot of them have lot of fear with regard to IVF, that IVF treatment involves lot of painful injections. It involves a lot of procedures which can cause a lot of pain, and it is an invasive procedure. So, I am here to tell you about how safe IVF can be and how easily you can go through an IVF cycle. So, definitely IVF is not a simple easy procedure, it definitely takes a toll on emotionally, financially, physically as well, but definitely I would say that it is not as much painful as one would expect. So, basically what does IVF involve? So, IVF involves stimulation of the female's ovaries, wherein we give injections to stimulate the follicles to grow. So, in a normal cycle in a female, only one follicle grows in a natural cycle, but in IVF we want to overcome this and we want as many follicles to grow as possible. So, we usually give her high doses of injections. So, these injections are usually recombinant injections, and we give them by a subcutaneous route, and previously we never had such recombinant injections, and injections were pretty painful, but these recombinant injections are very convenient to use. They are something like an insulin injection which can be easily injected by the patient themselves, and it's just like a sting of an ant. So it doesn't cause that much pain. But definitely the number of injections are like maybe 2 or 3 in a day, and it depends on the response that we get, and it's always monitored with scans. Now after around an average of 10 days of injections, it could be less or more, we usually have all the follicles ready and we subject the patient to an oocyte retrieval. Oocyte retrieval is a process which is done under anesthesia, so the patient will not have any idea of what's happening. So the anesthetist will be there to put the patient through an anesthesia, wherein the patient will not know any pain at all, and once the patient is out of the anesthesia, the procedure is very simply done, and within 2-3 hours the patient can walk around. We usually discharge the patient by 4 to 6 hours after the procedure. So it is a very simple procedure, it is not at all invasive, it just involves picking up the follicular fluid through a needle, and it is done transvaginally, that is with the help of a ultrasound probe, like how we do a scan. We insert the ultrasound probe and it is attached to a needle which is used to retrieve the follicular fluid. So the patient does not have to undergo a major surgery. We have no cuts on the body anywhere, so it's absolutely a non-invasive procedure. Once the oocytes are retrieved, we take the sample from the husband and fertilization is done artificially in the lab. Now once the embryos are ready, if the patient is ready for transfer in the same cycle, the patient has to undergo an embryo transfer. Embryo transfer is a process which does not even require anesthesia. It's a very simple procedure wherein we just put back the embryos into the uterus and help in implantation. So this process requires extreme skill, and if it is done with least pain to the patient and with the patient being extremely comfortable, then it is best done and the success rate will be extremely good. So after this embryo transfer, within 13 or 15 days, we ask the patient to come back for a blood test to know if she is pregnant or not. So this is all about an IVF cycle. Sometimes the transfer is not done in the same cycle. We may subject the patient to an endometrial preparation cycle and then go ahead for the transfer. So apart from the slight pain with those injections, there is no way pain involved in this entire cycle. Definitely it has a toll on the emotion, and the stress that it adds on to the patient is definitely considerable, because no treatment can guarantee you a pregnancy, and that itself is a very stressful factor. But I think there are a lot of ways that we can manage this stress, and now IVF has become extremely accessible, affordable, and if you know it's painless, I'm sure there will be many more people opting to this wonderful procedure which can help you achieve your dream of parenthood. Thank you.